How to prevent having a melasma mustache. If you enjoy being outside, you are aware of how crucial it is to protect your skin from the sun. If you don't, you run the danger of getting skin cancer, photo damage, premature aging, and sunburn. Another possibility is that you could develop a sun mustache, often known as a melasma mustache. While not as serious as skin cancer or sunburn, a melasma mustache can nonetheless be inconvenient and ugly, causing you to ask, why is my upper lip dark? We need to take a step back and discuss melanin, the substance that gives melasma mustaches their primary color, before we can discuss how they develop. Excess melanin causes mustaches with a melasma appearance. According to Dr. Akhtar, melanin is what gives our eyes and skin their color. Pigment cells called melanocytes, which are found in the innermost layer of the epidermis, are in charge of creating melanin. The skin darkens when too much melanin is produced. The result of this is known as hyperpigmentation. Dr. Akhtar explains that chloasma and mask of pregnancy are other names for melancholy. Melasma mustache treatment. Because they can commonly come back, melasma mustaches can be challenging to treat. Dr. Akhtar advises using many treatment modalities to effectively cure this skin disease. Treatment plans frequently involve oral drugs, light or laser therapy, one or more topical agents, sun avoidance or protection, and topical agents. However, she points out that some melasma mustache treatments can actually make them worse. They can assist in avoiding more issues and locating treatment choices that support your aesthetic objectives. Melasma mustache prevention. Melasma mustaches can be avoided by limiting your exposure to the sun and wearing sunscreen, especially on your face. Dr. Akhtar advises picking a sunscreen that contains physical blockers like zinc oxide and titanium dioxide. Sun protection rated hats with a wide brim should be worn. Search for a UV protection factor, UPF, of 50 or higher.